The World Health Organization says public risks from the Hantavirus are low. Arrangements are being made to repatriate passengers from a cruise ship after 3 people who'd been on board died. How's the experience from the COVID-19 pandemic being used? This is Inside Story. Hello again, I'm James Bays. A virus that few had heard of beyond specialist medical circles until recently is now making global headlines. Scientists say the risks from Hantavirus are low, but our recent experience with the COVID-19 pandemic means that public concern is high. The World Health Organization was alerted a week ago to a cluster of infections on a cruise ship which left from Argentina last month. 3 passengers have since died, with others being treated in hospital. Those remaining on the ship are headed to the Spanish island of Tenerife off the west coast of Africa, where they'll be screened. The World Health Organization is stressing the risk to the wider public is low, but the level of precaution shows just how seriously this outbreak is being viewed. So what is this virus? What are the broader risks? And what action is being taken? We'll find out when we talk to our guests in just a moment. But first, this report from Amabotang.
A luxury voyage turns into a global health concern. The cruise ship, the MV Ondius, has been linked to an outbreak of the Hantavirus. A Dutch couple and a German woman who were passengers have died. Several more cases are confirmed. But the World Health Organization says this isn't like the COVID-19 pandemic.
I need to stress again and again, even those who have been sharing cabins don't seem to be both infected in some cases. So the risk remains absolutely low. This is a dangerous virus, but only to the person who is really infected. And it's the risk to the general population remains absolutely low.
Let's go.
Health officials are racing to trace dozens of people who disembarked the ship before the virus was detected, and anyone who's come into close contact with them since. This is the route the ship took. It set sail on April 1st from Ushuaia on the southern tip of Argentina with 114 guests and 61 crew members. It stopped 2 weeks later in Tristan da Cunha in the South Atlantic, where the cruise company says 1 crew member disembarked. A week later, there was a 3-day stop in St. Helena, where 32 people got off. The vessel was close to Cape Verde, off the coast of West Africa, when tests confirmed the outbreak on May 2nd, after one of the passengers died on the ship. An announcement by the captain of the first death on April 11th has raised questions about the company's response.
I'm told by the doctor we're not infectious, so the ship is safe when it comes to death.
The company says that at the time of the captain's statement, the cause of death was unknown and there was no evidence of a virus. The WHO says it's identified the Andes strain of the Hantavirus, the only type that, in rare cases, can be transmitted between humans. Infection is often caused through contact with rodents or their droppings. The fatality rate is thought to be as high as 50%, which is why it's dangerous. Patients are in hospital in South Africa, the Netherlands and Switzerland, and health officials suspect a case in Spain and the island of Tristan da Cunha. The remaining 147 passengers and crew from 24 countries are now heading for medical screening in the Spanish island of Tenerife. The company says no one on board is showing any symptoms. But the incubation period of the virus is several weeks, so they'll continue to be monitored. Amma Boateng, Al Jazeera for Inside Story.
Earlier I spoke to Tarek Yasharovich, a spokesperson at the World Health Organization in Geneva. I began by asking him, bearing in mind the COVID-19 pandemic, how serious is this situation now?
Well, this incident, this event, we take it very seriously. But again, our assessment is that the risk for general population is low. Hantavirus is being transmitted normally to people through contact with rodents, with droppings of rodents. In some cases, and we believe in this case, there was a human-to-human transmission, but this human-to-human transmission requires prolonged close contact. So we need to put in place all public health measures to make sure that those who need medical care are taken care of, but also that we follow up those who have been identified as contacts, make sure that we know their medical status, and in case they develop a disease, they are also taken care of. But again, we think that the risk for the general population is low.
So you seem pretty clear this is not going to be an event like COVID-19, but has this all stress tested the global system? Have we learnt the right lessons? And have you found any gaps?
Well, this is a perfect example. Why do we need international cooperation? We have many countries involved in this public health event, starting with Argentina to Cabo Verde, to countries from where these passengers are. Some had disembarked, went to South Africa. There was a case in Switzerland. So we just realized that in case of a public health event like this one, we need international cooperation, not only between countries. We need to operate also with air companies, with ship operators, and there has to be a system to work together. Let me just give you the example of a Swiss man who tested positive. He disembarked, but then he was contacted and he was told that there was an outbreak on the ship, and if he gets some symptoms, to report to health authorities. This is what he has done in Zurich, and that's how we got to know about him. And this is why we need this mechanism of epidemiological investigation, of putting in place public health measures, and having this cooperation at the national level so we can respond as efficiently as possible to any public health threat.
One thing that perhaps is similar to COVID is not the medical part. Again, we have scaremongering, misinformation, the anti-science. Does that worry you?
Well, we have learned during COVID that misinformation is a grave obstacle to real public health action. I hope we all got that from COVID, and we hope that all partners involved in informing public, from national health authorities through NGOs, international organizations, we will do our best to provide and to educate public. Unfortunately, we know that misinformation is something that we will have to deal with. But again, our role is to provide the best possible advice based on the latest scientific knowledge to, first of all, ministries of health. And then we hope that ministries of health will find the best possible way to communicate this to their national audience.
Well, let's discuss all of this further with our panel of guests, panel of experts who can explain to us how serious this all is. In Marrakesh, Mukesh Kapila, Professor Emeritus of Global Health and Humanitarian Affairs at the University of Manchester. In Falange, in France, Dr. Margaret Harris, lecturer at the United Nations Institute for Training and Research and former chief spokeswoman for the WHO. And in Guildford, in the UK, Nicholas Locker, Professor of Virology at the Pirbright Institute. Thank you all three for joining us. Nicholas, let me start with you. You heard the WHO spokesperson there. Not like COVID, not all that serious. And I see that on their emergency level, they have it as low for the general public, no travel or trade restrictions advised. The CDC, which is the US Center for Disease Control, level 3, the lowest emergency activation level. Have they got it right?
Yes, so I think they got it pretty right. So since the record began for, this family of viruses, there have been less than 1,000 cases of hantavirus infection. So it's a very, very rare event. The other really key point is that the virus is really poorly transmitted between humans that are, in contact. And it's really rare events of a human being in contact with rodents or rodents droppings, urine, that can trigger infection. So I think they got it right indeed.
Mukesh, then, do you have any fears? Let's look at the worst case scenario. Any fears of another pandemic coming from this?
No, I think this is as far away from COVID as you can think of. It's a well-known virus. It's not like the coronavirus that was a new thing, and it was rapidly diagnosed. There are lab tests available, and information was shared very quickly amongst the countries and institutions concerned. So, and WHO has been outstanding in terms of getting information out far quicker than it did in the case of COVID, because we didn't know much about COVID when it first started. So I can't think of this being anything like COVID at all, as has already been said.
Well, you say it's a well-known virus. I'll be honest, Margaret, I had not heard of Hantavirus until last year, February last year, when we had the tragic death of the Hollywood actor Gene Hackman and his wife, Betsy Arakawa, and she died of Hantavirus. Just explain to us in layman's terms, what is Hantavirus and how do you catch it?
So you're right not to know very much about it. And indeed, that was a tragic case where Gene Hackman's wife contracted this on their farm. And that's what we have seen over the years, that a person in contact with rat droppings, often because they're maybe sweeping up, the rat droppings have formed dust because it's very dry, they're sweeping up and it's then reached their nose and mouth. And where that happens, which is a rare occurrence, they can get very, very sick. And if you do get enough virus from this source, you have got quite a chance of getting a severe illness. There are more than 30 species and they're different. Some are in Europe, some are in Asia, and some are in the Americas. And they are all actually different. The only one we've seen that's managed to pass from person to person is the Andes strain. And this is the one that's been identified on this ship. It caused quite a cluster back in 2019 where a farm worker went to a festival and 11 of those people died. So it is something that we've had, that I should say I'm no longer working for the World Health Organization, but it's been on the watch list. It's been on the global health watch list, not so much because it's not seen as something likely to spark a pandemic, but it's something that causes severe human illness if it does get into the human population. So it has long been on the watch list, particularly in the Americas.
So, Nicholas, let's turn to the ship, the MV Hondius, which started its journey back on the 1st of April in Argentina. Do we know how the Hantavirus got on the ship? I believe the investigation centre around a Dutch couple.
Yeah, so it's very difficult to have a definite answer to that question, but there are a couple of hypotheses, right? So as we mentioned already a couple of times, the virus is transmitted by rodents to humans. So one possibility is that passengers actually got into close contact with rodents or their droppings while in South America, where the virus is potentially present, and they boarded the ship with potentially no symptoms, but started to develop symptoms as the cruise started. The other eventuality is that some rodents were actually on board the ship, and that, again, through contact with the rodents themselves or droppings, urine, or saliva, this couple originally got infected, or perhaps even a combination of both.
Mukesh, so the journey started on the 1st of April. By the 6th of April, the Dutch man, we mentioned the Dutch couple, the Dutch man, 70 years old, developed fever, headache, and then on the 11th of April, he died. The captain then informs the other passengers, "It's my sad duty to inform you that one of our passengers passed away last night. Tragic as it seems, it was due to natural causes, we believe." And yet then, 20 days before they actually informed the WHO that they had Hantavirus, does that 20 days, almost 3 weeks, does that part of the story concern you?
Well, the Hantavirus has a long incubation period. It can be 6 weeks or even 8 weeks sometimes. What that means is that the captain obviously was speaking when he was speaking with the knowledge that he had at that moment in time, advised by the medical doctor of the ship. But clearly events evolved as the virus's incubation period was longer. and the outbreak and the nature of the outbreak became clearer as the days passed. Unfortunately, it is a concern when organisms have very long incubation periods, as this appears to be the case here. And that's why I think one has to be extremely cautious in pronouncements on anything until we know what more is going on, and also the importance of early assessments and careful tracking when something unusual happens, whether on land or sea. So what happened, the trail is interesting, but quite honestly, I don't think anyone could have done anything different. It just took time for the experience to unfold and the number of cases to then raise alarms, first on the ship, then in terms of the clinicians who were looking after the patients who were evacuated, and then, of course, we know where we are.
Margaret, this particular ship, run by a company called Ocean-Wide Expeditions, is not your typical cruise ship, as I understand it. They describe it as an expedition ship, often with scientific, wildlife or geopolitics lecturers on board. And I'm told the experience of previous passengers is they have very strict safety protocols because of the places they visit, mainly for biodiversity reasons. Previous passengers have recalled sniffer dogs and having to wear sanitised boots. If it can happen on a ship like that, do you have concerns in general about going on cruises? I mean, are they incubators for disease? Would you go on a cruise holiday?
Well, I'm a bit sort of, I don't like crowds. So I'm not a good person to ask. But I think certainly cruisers know that there is a risk of infectious diseases. They often get norovirus and other gastroenteritis viruses that can pass very rapidly through the group. So they're actually more likely to be more alert to the risks of transmission because they know they're in a closed environment. And I'd like to say about this group also, all the people have shown such a level of responsibility and a very reasonable and good reaction, particularly the passengers who developed symptoms and then identified themselves and ensured they got to care very quickly. I am super impressed in many ways. As I said, that the risk to the general public is low here, but if we had something more dangerous to the general public, it couldn't happen in a better group of people because they are really, my impression is they are super responsible people.
Nicholas, nevertheless, despite what Margaret said, this ship has left a trail of global cases because people disembarked from the ship. Do you think the ball was dropped at any point?
I don't think so, because it's we mentioned the long incubation period of the virus, the time it takes for the symptoms to develop. So I think the crew and the company actually reacted in a pretty reasonable manner. I think we have all the tools to actually track passengers. There is enough awareness now of the symptoms. And so I don't think we have left, this cruise ship passenger, let's say, abandoned at the moment in terms of how the situation was managed. Yes, it is, stressful for the people that are still on the ship and, wondering, for example, whether they are infected or not. But, processes are in place to actually test everybody on the ship before they will be allowed to disembark. And there is close monitoring from the health authorities in the different countries where the ship has stopped. So I think here we see a really good global collaboration and coordination, and I'm quite optimistic about the whole situation.
Mukesh, as we've said, this is not COVID, but they are zoonotic diseases, so a disease that jumps from animals to humans. Given that we're 5 years, nearly 6 years on from COVID-19, this was a test of the global system. Would you say the system passed the test?
I think, and I'm a very critical person, And I've been searching for critical things to say, but I have to say that actually everyone in this particular case, whether it's a country concerned like Argentina that has actually left the World Health Organization, or the World Health Organization itself, which was a little bit not so sure-footed in the case of COVID, or whether it is a sharing of information between three continents, as it turns out, it's been remarkably exemplary. And we are at a time of, multilateral fractures and a lot of geopolitics that is going on, not least in international health, not least in relation to the World Health Organization. But in this particular case, regardless of where you stand on the political spectrum, everybody did their part as best as they could. And by the way, if I can get back to your previous question, thank goodness this is a slow-moving cruise ship. Imagine if, for example, 134 people were sitting in a big plane out of Argentina, flying to all the corners of the world very fast, and then disappearing into the world. So I think back to the cruise ship thing, if I can also come back to that, it is to say that the only difference between a cruise ship and a prison is that a cruise ship floats on the sea. And I, for one, am looking forward to whenever I can ever have the opportunity to be able to afford a cruise somewhere in the world.
Margaret, the ordeal for the US citizens is not over, because my understanding is the US government want to send them to a biocontainment centre in Omaha. Do you think that is the right response? They're going to send them where in the past they've sent patients with Ebola.
Goodness, yes, certainly the people who experienced that during Ebola did not enjoy it. And this will be a long period of confinement if that's the decision that's being taken by the US authorities. My biggest concern about something like that is it may be seen by others as a severe punishment. And if the consequences of identifying yourself as somebody who may be to potentially be exposed, if the consequences are so severe, people may not be willing to identify themselves. Now, I think in this case we do know. I think we've managed to trace, or we're in the process of tracing, nearly everybody who has been exposed. But when you make decisions about how you manage the people and the containment of a potential outbreak, you do have to think about whether it's going to be acceptable to populations, because if it's not acceptable to populations, it goes underground. We saw that with Ebola in the large West African outbreak, where the consequences of identifying cases of Ebola was something that was entirely unacceptable to the population. So you really have to think hard about how you manage it to ensure that you don't spread the virus, but also ensure that people are going to be willing to comply with what you ask them to do.
Nicholas, all three of you have made it clear that you think the system has worked, but the system relies on international cooperation. Two of the countries involved, the US and Argentina, have pulled out or are pulling out of the World Health Organization. Does that worry you going forward?
I think it would, any country pulling out of the WHO is a concern. I think for the management of large or indeed small outbreaks, we need collaboration, we need sharing of resources, of screening data, of virus isolates, so that we can trace outbreaks, so that we can identify patients. So yes, this is worrying.
Mukesh, I mean, it's all about medical, but it's also about more than medical when you deal with global health. And again, we've had the problem of misinformation, particularly about Moderna, that medical company that has been involved in research on a vaccine linked to Hantavirus with the Korea University. But actually, it's not even targeting this Andes strain. Yet prominent people, notably the former US Congresswoman Margaret Taylor Greene, has claimed that Moderna is manufacturing a bioweapon. How worried are you about the spread, not of a virus or disease, but the spread of information?
Well, actually, that's the real deadly virus, the virus of misinformation and disinformation, as particularly in this case. In fact, I randomly went on Facebook and I was just appalled to see the sort of rubbish that is being propagated there on Facebook. Now, I do not think that there is a virus against that. And therefore, it is an ongoing effort from all concerned, and especially social media companies, but also governments and institutions, to make sure that accurate information gets out. We're conscious, thank goodness, for information-based humanity expressed by the Spanish government in allowing this ship to actually come to the Canaries, and from there for the people to be screened and taken to their homes for whatever other measures are needed. And that, I thought, was an example of leadership against the disinformation that is in equal measure the real pandemic around the world. However, having said that, the answer to this is clearly to get information out, to get the science out, to educate people, and for the policymakers to show leadership, as the Spanish have done, as, for example, W.H.O has, Dr. Tedros has done, to try and get into the heads of people. No shortcuts there. It's something that has to be done every day. And every time something like this happens, we have to just carry on repeating the same old lessons.
Let me ask you briefly, Margaret, to add to that, because this used to be your job at the WHO, getting accurate, factual, scientific information out. How much of a challenge is it in today's world?
It gets to be a bigger challenge every day, and it's actually still my job. And I appreciate this program because you're making an effort to get the right information out right now. It's something you have to continue to do, and it's getting harder and harder because there's been such a loss of trust. There's a great loss of trust in authorities. The conflicts, I don't want to get into all the other things going on in the world, but the level of conflict, confusion, distress, distrust means that people just don't know who they can trust these days. But the critical thing is, just as was just said, is getting out the information we have as quickly as possible, acknowledging we don't know everything, but acknowledging, also making every effort to find out what needs to be done and letting people know as quickly as possible what that is.
Dr. Margaret Harris, Dr. Mukesh Kapila and Professor Nicholas Locker, thank you for joining us. For the very latest on this story, stay tuned to Al Jazeera. And if you want to go a little deeper, you can get more information, context and analysis on our website, aljazeera.com. Let us know what you think. Go to our Facebook page. That's facebook.com/AJ Inside Story, or on X. There you'll find us by looking for @AJ Inside Story. For now, that's it from me, James Bays, and the team here. But Al Jazeera's coverage continues around the clock. Stay tuned for the latest in just a moment.